Yes, I've been in this space for quite some time. Sometimes I want to give up because very little or so much is happening, but there's very little progress when it comes to maternal mortality, especially in low and middle income countries. And let me speak about the countries that I know quite about. As a midwife myself, who has worked in most of these countries, what I am really left grappling with each and every day is the day that we will make maternal mortality an issue of urgency, and we'll make equity and quality the center stage of everything that we are doing as actors in the space. Looking back at the 16, 17 years that I've been working, I feel like there is the desire to change, but there's no really like the urgency to change how things are being done. And let me speak as a midwife who has witnessed death of mothers and finally decided, let me be the advocate, let me speak out on the issues and maybe bring to the fore what is really happening. Over the last few years, what I'm seeing is actually complications in terms of how this is being delivered across board. And when I talk about complications, I look at the forces that are actually complicating the issues that we are around maternal mortality across board. We are talking about conflict. We have so many countries where there's conflict, and where there's conflict, maternal mortality and newborn mortality is high. We're talking about the pandemic, the COVID pandemic. It's really like made regressions in terms of the advances that we are done in maternal mortality across board. We're talking about climate change, and we know that climate change affects women, mothers, and their newborns across board. And we know how, and we've seen how. But yet these are the least contributors to the climate change across board, but they're the most affected by the climate changes. When you talk about the cost of living, affordability of our health services, and that now brings again to talk about the quality and equity, is at stark. And I think at the end of the day, I keep asking myself, then what are we not doing right? I've taken time to really think through and look through what I've had in different places. There's a lot of commitment around reducing maternal newborn mortality. There's a lot of commitments in terms of ensuring that we reached fast and there's no leaving anyone behind. But when I look at it closely in terms of how that translates into action, I feel like there's so much and there's so many people who are left behind. One, let me start by the midwives. I'm a midwife myself, I work in spaces and I've listened to midwives. We just finalized a campaign last year of Midwives Voices, Midwives Demand, listening to midwives, trying to understand what is it that is making midwifery an issue. Midwives not do what they ought to do. And it's a place of the fact that midwives have been left behind in decision making. They are not in leadership positions. They are the least paid in the pay ladder for healthcare workers, and so much and so forth. And yet we know that they are the majority and the people who are with the mothers most of the time. And that tells me that there's a place that needs of action that is needed by the actors in the space. Now, coming to the communities and the mothers themselves, I led the campaign, What Women Want in Kenya, is that mothers have defined quality in a very different way, way far from how it's defined by the global community, maternal health community. And that tells me then that there's something that has been missing. Communities have been on the back burner in terms of advancing maternal health in our countries and the like. And I think it's a place of not just saying, let's engage communities, but moving down to working and engaging communities, because they are the ones who know what the solutions are, where they're living. They are the ones who experience the different issues that they experience in the health communities, in their with their governments, in the health facilities and the like. And so there's a place of us ensuring that communities are at the center stage. I call them the real experts of care, and their voices will be so big and will help us so much in advancing how care is delivered and how investments are done. Because the more we continue to work alone in our own silos, avoiding these groups of people that are really the key drivers in terms of what we want to do, the more we'll continue going the wrong way. It's like you're walking to a destination. You don't know the place. You are a new visitor. You don't know the context of the place, but you want to tell yourself that you know. And at the end of the day, by the time that you are realizing that you've made a mistake and that you need to, it will have taken you so much expense, it will have taken you so much of your time and resource, and all these are resources. And at the end of the day, you'll need to come back and start afresh. We've made the mistakes. We've moved along without the right people in the front lines, the midwives, the communities, the mothers that are supposed to be helping us in make the right decisions. I think for me, it's about time that we stopped, we dropped everything and listened. Not just listening to ourselves like we've done in many spaces, in many conferences and workshops, but listening to these groups of people that are so critical in redirecting our investments, redirecting our thoughts, redirecting our direction in terms of what we need to do to advance maternal and newborn health across board. I think the whole thing that has really messed the global maternal health community is what I call the plug and play narrative, where we design things at the global space. And I'm not saying that designing those things is wrong, but can we design them with the right players on the table? The midwives, for example. And I'm not just talking about the Midwives Association. There's a Midwifery Association, which is really critical. We have the International Confederation of Midwives, which is critical, but we also have midwives in the countries, in the front lines, who need to be listened to. And what they're saying needs to be taken seriously. Can we drop the theoretical aspirations and the aspects that we have and listen to the lived realities of midwives and mothers and families and communities and the partners and the parent groups and the like, and be able actually to design projects and programs around what we are hearing? Let's not just listen to tick boxes and say we listened in our papers, in our theoretical papers, but listen, hear, and act. Because until we do that, then at the end of the day, we'll just be walking this distance and then getting lost and allowing and continuing to get lost in the dark without really realizing that we made mistakes. Can we learn from what we've been able to do, or from other communities that have done things that have really worked, and move together for change with a sense of impatience and urgency? Because until we get impatient and urgency that this one life is one too many, we'll still continue dragging our feet. And before long, 2030, the SDG goal will have reached, and we look back and really pity ourselves at how much you've spent, but how poor the outcomes continue to be.